Good afternoon, everyone.
Good afternoon, ma'am.
Good afternoon, ma'am.
Okay, before starting the session, I would like to tell you that I'm also going to issue your first assignment under the module Promoting Equality, Diversity and Inclusion in Health and Social Care. At the end of the session, I will tell regarding the guidelines, how you are going to do the assignment and what are the points that you need to add when you are doing your assignments. So now I'm going to start the session. Can you all see my screen?
Yes, ma'am, we can see your screen.
Okay, thank you. These are the learning outcomes of today's session. So all these don't think about too much regarding the outcomes. Each and every learning objective or the goals of today's session are very, very small things. Okay, so at the end of today's session, you will be able to define what is an audit and why this audit is important in health and social care, and what are the types of audits are available. Wait a minute. And what is this medical audit and the clinical audit and types of medical audit? Explain briefly. You need to explain briefly about the need, why we are needing the medical audit and what is the purpose of clinical audit. And I need to brief out regarding the nursing audit as well, and how you can evaluate the quality of life or the quality of care of a care service, and what are the roles of hospital administration when we are talking about this medical and the clinical audit, and what are the advantages of clinical audit, and what are the issues or the problem will arise when this medical audit could be done. Okay, so we'll see one by one. First, we'll see what is this audit mean. So normally audit is a systematic and critical appraisal. Appraisal means an assessment method. It is a type of assessment, but this assessment type, it is a systematic one. So we are having a sequential order. Each and there are stages or the steps are available, and those assessment are not the simple assessment. They are the very, very critical assessment. So we need to check each and every steps. So it is a systematic and the critical assessment of the planning. So how we plan a care and how the care was delivered and how the outcome of the care. So in terms of efficiency, effectiveness and quality within the given resources. So in the yesterday's lecture, we studied regarding the efficiency and the effectiveness for the policy. Okay. So efficiency means it is normally we are talking about the cost of the resources that we are used and the duration, all the things included in the efficiency. When we are talking about the effectiveness, it is the way that we are the action of the services or the policy or the program, we are calling it as the effectiveness. So audit is also like that. So this audit, normally we are defining it is a systematic critical assessment of the planning or the delivery or the evaluation of the services, how we are assessing with the help of, we are telling whether the audit whether the services are efficient or whether they are effective, how about the quality according to the given resources. Evaluation of data, documents and resources to check performance of systems if meet specific standards. So here the audit also a kind of policy evaluation. So so the word audit is commonly we are using in all the normal workplaces. whether it's a banking or any bank or any other companies. And at the same time, even in the health and social care system also, we are having a different kind of audit. So, but the basic concept of all the audit is we are checking, it's a kind of evaluating how the action plan is going on. Okay, but the method of evaluating could be differ depending on the work setup. So here we'll see why this audit is important. So when we are talking about the healthcare or any other social care, any other workplaces, why we need to have this audit? First one, maintain participant and the staff safety. Yes. So we need to maintain both the people. So participant means we can talk about the patient. When we are talking about the healthcare system, patients are the participants. Or if we are talking about any other companies or any other workplaces, the consumers or the common people who are getting the services, the care recipients or the service recipients, we are calling them as the participants. And the staff, it could be a healthcare professionals or any other employees and the employers. So we need to maintain their safety. So for that, this audit is important. So safety means a kind of illegal safety. So we can, when we are talking about the staff or the participants, if they feel or if they encounter any wrongdoing or any kind of harassment or bullying, so with the audit, so it is, we are telling it is also a kind of evaluation. So we are having a written legal document records. With that, we can claim for our safety nets. Maintain the data quality. So yes, so with the audit, we can maintain whatever the data that we have collected for the analysis or for the evaluatory purposes. So we can maintain the quality of that data. So without any improper manner, we can have a accurate quality data. Protect reputation of staff, organizer, and hospital. Yes, if we have the audit, it can be, we can have it continuously or it could be a periodically. So if we start to have this audit, it can hold or it can maintain the name of a particular staff or the particular organization or hospital or any other companies, bank. So we can protect the reputation. So otherwise, if we have the audit only, we can identify if there is any mistakes is going on or how the action plan is going on, what kind of progress we are, whether the progress is our expected progress or not. So if we have the audit only, we can identify those important points. If we identify the important points at the early stage only, we can make the alteration or the changes. Then it will be helpful for to protect. Otherwise, if we are not having any auditory evaluation, then we doesn't know, we don't know how the actions are going on. So if there is any unexpected issues or the unexpected changes occurs, then the name of the particular hospital or the name of the particular staff who is doing all the activities could be get corrupted. So in order to prevent those things, we need to have an audit. Protect current and future funding. Yes. So normally we are when we are talking about the audit, we are mainly focusing the financial activities about the cost budget, how we are having or how we are planning for a particular action plan. So having an audit, it will protect the present as well as the future. So how we are having the budget or the funds now, and how can we improve or how can we have the funds in future, or the funds that we are having present is enough to for the future developments, or those things we can have or we can identify with the help of this audit. Yes, improve the quality, all the quality we can improve, useful for the clinical improvement as well. So when we are talking about the healthcare setups, this clinical improvement also could be very helpful. Why? We are having an auditory evaluation. With the evaluation, we can identify the drawbacks in a care services. Then we can identify the drawbacks, and we could it could be helpful for the improvement of the practical skills or the practical knowledge of each and every staff members, which would be more helpful for the outcome in the each and every patients. Encourages the teamwork. Yes. So another important thing is teamwork. So when we are talking about one hospital or inside the hospital, when we are talking about one ward, each and every ward, so if we have the auditor evaluation in each and every person, or when we are going to have the auditor evaluation periodically, then each and every members who are working for that particular organization, they starts to think that they need to enhance or they need to empower their particular organization. So for that, they will think they need to work in a team. So with this, so with the auditor evaluation, we can encourage a team spirit among the workers, employers or the employee, between the employees and between the employer and the employees. So likewise, we can improve the teamwork and improves the patient care. So this encourage the teamwork. It could be applicable to any kind of workplace, not only to the health and social care setting, in any kind of workplace, common community, other workplaces as well. So yes, so when the teamwork and all the activities, the action plans are monitoring in a good manner, ultimately the last or the it can improve the patient care in where more where when we are compared to the past, we can improve the patient care. Then the financial benefits, yes, if we have the auditor evaluation, we can have a financial benefits as well, contractually an obligation as per government policy. Yes, so with the help of the audit, we can identify whether these are the action plan is going aligned with the government policy, or if there is any opposing activities undertaken against the government policy. So those things we can identify. So these are the major importance of having an auditing any kind of workplace. So these points including both the health and social care settings and other normal community workplaces as well. Next, we'll see regarding the types of healthcare audits. So there are different kinds of healthcare audits are there, but basically we are dividing the healthcare audits as two types: internal healthcare audits and the external healthcare audit. So here, so we'll see the difference or the difference between the internal and the external audit. So points. So the first criteria or the feature is the scope. So to whom or to which part we can administer or we can apply this internal audit. The scope of internal audit determined by the management, as well as the scope of external audit is determined by the relevant law. So management means the higher ruling authority. If the hospital, then we are telling it as a director or the higher authority management. Or when we are talking about any other community workplaces, the major higher authority. So the internal audit will be determined by the management. That means the auditor evaluation is normally done by the internal members, the higher authority members of the particular institution. But when we are talking about the external audit, it is determined by the relevant law. So the law and the regulation could be basically imposed by the government. The government, they are having each and every laws for the employees, employers, voluntary workers. So each and every country having different laws for each and every workplaces as well. So in that kind, so external audit means we are having external members. So external members, they are determining according to the law. That is the difference between the scope. So when we talk about the objective or aim, the goal of the internal audit means, so it is helps to detect and prevent the errors and frauds. Yes, when we are having the internal audit only, we can identify what are the corruptions or what are the practice or malpractices or what are the errors that could be happen or that are undertaken by the members of the particular organization, because mostly the external people want, if there is no any legal document, or if there is no any written legal documents, then the external people can't actually identify the errors. But if we are talking about the internal audit, so it is going to undertaken by the management. So the particular management will know about each and every employee, or the each and every the works that are assigned to the each and every employee. Then it will be easy for them to identify what if there is any errors or the mal corruptions occurs. And it will be if we know that, then it will be helpful to prevent those things at the very beginning as well. So this is the objective of the internal audit. When we are talking about the external audit, the main objective is to show fair and true view of accounting record. Yes. So it is simply showing the record, whether the records that are maintaining by the each and every institution is correct, whether they are fair or whether they are true. So there is no any biased. So all the people in the all the employees in the organizations are getting a fair payment, or they are treated fairly. So the external audit checking, and the main objective is to show that the organization is undertaking its work in a fair manner. Then when we talk about the duration, the period of internal audit, it could be conducted for any time of duration, any time. There is no any time limit. If you want to do the internal audit today, then you can do. Or if you are going to do the internal audit 2 years or 3 years after, then you can do. So there is no any time duration, limited duration for the internal audit. Whenever if we think there is going to be any corruption is going to be happen, then immediately we can have this internal audit. But the external audit, it is having a certain time period. Why? Because it is mainly going to happen by the external evaluators, which is mainly focusing on the relevant law. And also it is going to show whether the accounting or the documents are reliable or not. So if we want to check whether the documents, records, reporting are valuable or not according to the law, then we need to have some period of time, or we need to wait until those reports should be completed. So without any fully completed or the accurate, without any inappropriate documents and the reports, we can't do, or we can't do any analysis. So for that purpose, we need to have a specific time or the certain time for the external audit. When we are talking about the reports or the records, in the internal audit, the report is submitted to the management. Yes, why? It is normally undertaken by the management and the internal members. So directly we are submitting those reports to the management. Then only the management have the authority to take the actions against or according to the results of the reports. But external audit, the reports are submitted to the shareholders. When we are talking about the shareholders and the stake. So yesterday I told you what is the stakeholders. Stakeholders means when we are taking one workplace or the institution, so the people who are working or who are contributing for the enhancement of that particular institution, the both the people, the I mean both the employer and the employee, we are talking as a stakeholders. Shareholders means sometimes some people may have the sharing. If we take any companies, the company could be arised due to the partners, for the partners. Or when we are taking about these NGOs or any other, some there are some institution, healthcare institutions, like education institutions, which are undertaken under the partnership of the foreign collaborative institutions, the are there. So in Sri Lanka we are also having. So if we find out any improper or the records after finishing the external audit, the documents or the reporting of all the auditory activities are submitted to not the internal members. If the particular organization having other collaborative partners, then they are going to submit those collaborative partners all the reports. Then they will go through and identify whether the action plan is going on very well, or whether there is any overaction, or if whether the outcome is good or fair, whatever, they will check. So this is the difference between the internal audit and the external audit. So here also you can, so are you clear up to the difference between the external and the internal audit? Or do you have any doubts? Do you have any doubts regarding the difference between internal and the external audit?
No, madam. Clearly, clear.
Okay, thank you. Now we'll see the functions of this internal audit. What are the functions? What this internal audit will do? Monitoring of the internal control. Yes, it is monitoring how the internal activities of a particular institution or the organization is going on, and it examining the financial and the operating information. So how the budget, the cost of a particular action plans, or how the action plan is formulated, and how it is going to implemented, how the process of that action plan is managed or monitored by the internal audit. And the risk management. So if there is any risk, when we are talking about the management of the action plans, whether any issues or the problems are arising. So if the problems or the issues arise, how you are going to manage those risks and the problems. Then review of compliance with the laws and regulation. Yes. So then they are going to evaluate. So they monitor how the control is going on. Then they are going to evaluate whether the functioning, the action plan or the people who are working, whether they are adhere to the laws and regulation of the particular institution, or simply we can tell it as policies and the procedures. Each and every organization, they are imposing one policy or the procedure, whether the people who are working in the particular institution, whether they are accepting and whether they are following. So this internal audit, they are evaluating in that manner. Then the governments, so they are governing. So how they are monitoring. So through the monitoring and evaluating, they are governing whether all the activities are going on in a proper way. And also they are evaluating the operative activities, the progress of the action plan, how the progress of the action plan is going on, whether there is any issues, or whether there is any need to change or alter, or whether we need to alter anything. So these are the functions especially undertaken by the internal audit. When we talk about the external audit, so external audit is the audit of the company's financial record, in which the external auditors perform out the task of examining the validity of the company's financial record. So normally whenever we are talking about the external audit, so audit means we are mainly focusing for the financial, economical activities of a particular institution. And among that, external audit, they are mainly focusing on the records of those financial activities. So they are examining, they are checking, they are verifying how about the economical activities of each and every institution, and examining the validity of the company's financial records to evaluate whether there is any mistakes in the records due to fraud, error, or embezzlement, and the reporting the same to the company stakeholders. Yes, so they are mainly where. So here they are talking about one company. Okay, a private or the public institution, normal, other than the healthcare institution. So they are checking the financial records. And when we are talking about the healthcare, so hospitals, private hospitals or the public hospitals, so this external audit could be applicable to there as well. Why? So each and every, so when we are talking about the hospital setup also, so in Sri Lanka, we are having a free healthcare services. So the medications, the equipments, and the equipments, medications that we are using for the care services, we are not claiming money from the common people, the community people. I am telling about the public hospitals in Sri Lankan setup. So so when we are talking about the medications or the other equipments, so those things also we need to buy. So they are provided by the government in a free of, they are provided by the government to the hospital, but the government needs to allocate a separate money. When they are talking about the budget, they need to allocate separate budget for the healthcare services as well. So we don't know how the each and every medications and the other, when we are talking about the face mask and or other any that surgery equipments, scissors and all those things, there are a lot and lot of then saline bottles and other IV sets. So there are some equipments we are using when we are going to have a care for any disease condition. So we don't know how much they cost. Actually, each and every care services that we are gaining from the public hospitals, they are very, very expensive. If we are going to have the care, or if we are going to gain the care from a private hospital only, we will know how we need to pay, because for each and everything they are asking money from us. But when we are talking to the public setup, we are not having, or we are not spending cost for the healthcare services. They are very free for us. But we need the higher authority or the management, hospital management, they should allocate separate, or they should prepare a budget for each and every articles. So those management, they are normally doing from the lower level. Lower level means from the ward setup. So in the ward setup, each and every ward they are having. So these activities are mainly governing by the ward in charge nursing officers, or the nursing officers, or the sisters. So those are handled by the nursing officers, because most of the time the nurses are available in the ward setup. Okay, for that, so they are having the higher responsibility of the resource management. We are telling it as a resource management. So each and every ward having a ward in charge miss or master, or the in charge sister. Those, they are the nursing officers. They need to provide weekly or monthly, they need to provide each and every drugs. They are has we are separately following a drug book, and there are IV medications, the medications that we are inserting in a liquid form. So IV medication, oral medication, likewise we are having a separate records. So in that records we need to they need to have some kind of calculatory method, how much they have gained from the management, and how much of the medications used for each and every patients every day, and what about the available stock. So how much they need, because they can't simply requested to gain the request regarding the medication from the higher authority. If they need to, because normally the higher authority, they are making a budgetary evaluation, and they are dividing the medications, so all the equipments according to the number of patients admitted, or number of patients, or number of beds they are, or the number of beds they are having in each and every wards. So sometimes if the patients, the need of the particular medication could be increased rather than their calculatory method. So if the medication, and also they have planned a kind of duration. So within 1 month, paracetamol or the Panadol, uh, one stock is enough. But sometimes due to the increase of the patient, if there is any pandemic arose, then there could be, we can't tell. So more and more patients will be admitted. So in that situation, more and more medications will needs to give to the patients. So if they needs to gain more medication uh, other than the confined medications given by the management, they need to submit the record regarding how much they give, and how much they expected to deliver, but how much they spent, and how much they still needs for the management of the patient. So these are the kind of records. Then they will submit it to the higher authority, higher management. They will go through, and if all the financial records are correct and there is no any errors or the corruption, then they will provide. So same thing, normal, how the normal audits, the financial records are undertaken by the normal other private companies or other institutions other than the healthcare institutions. Similar thing happens in the hospital setup as well. And when we are talking about the private hospitals, so sometimes the private hospitals could be in a collaboration with two or more partners. So in that manner, they also need to submit the recordings of the financial recordings to the other partners or the other shareholders. So this is regarding the functions of internal and external audit. So I already told you there are different kinds of audits available, but simply or the basically we are dividing them as the internal and the external audit. So here, depending on the activity and the personals who are involved, we are dividing the audits into again 3 types. So these medical audit, clinical audit, and the organizational audits are dividing depending on the activity and the personals. Personal means the people who are engaged in the institutions or the audits. So first one is a medical audit. Medical audits involves the reviews of activities initiated directly by, yes. So normally medical auditor especially reviewing the activities or the actions which are undertaken by the clinician. That means physicians, doctors. Doctors means it could be a consultant, senior house officer, registrar, senior registrar, intern officer. So all the physicians or the doctors who are coming and who we are telling we are reviewing or we are evaluating those people's activities. So that we are calling it as a medical audit. When we are talking about the clinical audit, it is especially covers the clinical care. So normally clinical care, we are talking for the nursing and other paramedical care. Other paramedical care means pharmacist, physiotherapist, medical laboratory scientist, other biomedical and the people. So other like physiotherapist, occupational therapist, speech therapist, audiologist. So those will comes under the paramedical and paramedical care. So this clinical audit especially focusing on the nursing and the other paramedical care. And this organizational audit, it is especially refers to the investigation of aspects of practices such as appointment system, policies, practices, standards, which are regarded as a primary administrative function. Yes, organizational audit, we are talking to the higher management. So the people who are dealing with these policies and procedures, rules, regulations, and the guidelines or the principles. So those administrative functions, we are classifying them as organizational audit. So especially these 3 medical, clinical, and the organizational auditor, we are dividing according to the persons who are the people we are referring to. But the internal and the external audit, they are the basic. So we can, these medical, clinical, organizational audit could be comes under both the internal and the external audit as well. So these are another kind of classification regarding the audits. So are you clear up to now? Or do you have any questions? If you need any clarification, you can ask. Or if you are going to tell any suggestion also, you can tell.
In health and social care sector, only having this different audits or other other
Yeah,
sectors
these
can.
different audits, we are especially focusing on the social and healthcare sector. Why? So here you can see, normally we are referring the people to the when we are talking about the health and social care sector, these three audits are available. But when we are talking about other institutions, each and every institutions may also have different kinds of audits. But in other institutions, commonly there are two members, no employer and the employee. So there is no much importance we can give for the different audits. But in the health and social care sector, there are different kind of healthcare professionals are there, and each and everyone having different responsibilities. That's why we are and and the clinical audit, it specifically involving the nursing and organizational audit, mainly focusing on other policies and the administrative purposes.
Okay, it's depend on the type of business, na?
Are you clear?
Yes, miss. It depends on type of business.
Yes, it depends on the type of business or the institution. Yeah.
Thank you, miss.
Okay. So any other doubts? Any other one? Anyone needs to tell anything? Your suggestions regarding the audit?
We are talking about internal audit. It's
Yes.
like that daily bookkeeping likewise, no? Those things, no.
Sorry?
When we are talking about internal
Yeah.
audits,
Yeah.
it's like that bookkeeping, that kind of things, no?
Yes. Yeah. You are correct.
And external year by year that they are doing some that other
Yeah.
parties
After
doing that kind, no? That some
yeah.
audit officers come into the
Institution. Normally in the
yes.
banking setup, they are having now yearly audits or the or 6 month audits, like external and other branch bank members are coming to another branch banking, and they are having and they are go through the records, all those things. There we are telling as an external audit.
Yes.
Any other doubt? Or shall we move to the next slide?
Okay, ma'am.
Okay, thank you. Now we'll see what are the methods or what are the instruments or tools we can use in this audit for the auditor evaluation. What are the methods are available? One is direct observations. And the direct observation means so without telling like without as for the internal audit as well as the external audit. So normally for the internal audits we know we can have the direct observation because the internal audit is done by the internal management or the internal members. So we can have a direct observations how the employees are working. If you are going to or have auditor evaluation to a particular staff, then we can monitor how the person they are working and how they are doing the activities, what are the actions they are taking in promoting the action problem. So those things we are telling it as a direct observation. Through the visualization of a particular action, we can use or we can have a method in audit. We can assess the audit. Then checklist. So checklist means we are preparing so each some criterias. What are the criterias we are going to have? So for that we can have some graded system. It could be a pointed form. 1, 2, 3, 4, 5, or it could be a B, C. So whatever. So each and every institution, depending on the people, auditory people, they have a checklist. So like having so they are so how what are the components they are going to include it when they are making the audits. So they are preparing one checklist which contains all the criteria, and for each and every criteria they may have some marks or the grades, and they will start to put each and every marks or the grades relevant to the each criteria if it is present or not. Then at the last they will calculate the total and they can have a kind of idea or they can come to one conclusions whether the marks or whether the points the particular or due from the audit, whether it is the gained marks is good or bad or fair or they need to improve, what are the problems. So that is we are telling it as a checklist. It is another kind of way that we can use in an audit. Documentation or the record audits. Yes, it is simply so they have documents and the records. So with the documents and the records, we are go through all those things and we are telling. So how the records and the documents are. And the questionnaires. So questionnaires means, so we are preparing. So normally these questionnaires, it's like a feedback forms. Okay, so we are having a set of questions. So and the options could be available or we are asking the people to provide the answers. So and we are giving to all the, so when we are talking about the internal audit, so the higher authority management, they are preparing a set of questions and issuing to all the employees who are working and they are getting some idea. So how they are thinking about the institution, the particular plan. So all the management is taking one policy. So they start to implement that policy. Before that, they are having a set of questionnaire and issuing to all the employees how the feedbacks, how the response is. So it is also kind of audit. So we can make with the questionnaire, then interviews. So like a direct observations. In the direct observation, we are not having any contact or we are not having any but give me 2 seconds. I'll join. Okay, so when we are talking about the interviews, so we can have a direct communication, face-to-face communication with the people, or we can have so after go through all the records and all those things, we can ask a particular person to come, and we are having an interview. We are talking with them. So why the progress is like this, and what is your suggestion, what you are going to do. Likewise, we can have an interview. And when we are talking about the clinical case reviews, some mainly we can have in a hospital setup. So how they are providing the care, whether the care provided is efficient or not. So the clinical case review we can do by observing, by without communicating with the people. We can observe when they are providing the care to the patient, and also after the care, we can get the information from the patient as well. So we can have a direct interview with the patient, or we can give a kind of set of questions like questionnaires, and we can ask, so how the patient is feeling now, what about the care he is receiving, whether the healthcare professionals are doing good or bad, whether they are providing adequate informations before starting the care. So those things we can have in a clinical case review or the clinical case evaluation. So these are the common methods or ways that we can use during the auditory evaluation. Now we'll move on to the medical audit. So far we have discussed what is the audit means. Commonly, audit means what, and what are the basics types, and how we can divide the audit depending on the persons who are involved. And as I already told, that it is mainly focusing those three: medical, clinical, organizational audit for the persons who are involved, and also it is depends on the institution as well. And why this audit important, why we are having the audit, and what are the common methods that we can use in any type of auditory evaluation. Now we'll move on to the specific one. First one is a medical audit. So we'll see what is this medical audit means. A planned review program which objectively monitors and evaluates the clinical performance of all practitioners, records by qualified professionals to identify, examine, or verify the performance using established criteria. So when we are talking about the medical audit or the clinical audit, whatever, so through this medical audit, we are observing, we are evaluating, and we are reviewing, monitoring the activities undertaken by the healthcare professionals, clinical practitioners. Especially for the medical audit, we are focusing on the physicians, doctors, how they are actively working, how they are diagnosing each and every diseases, how they are communicating with the people, whether their diagnosing is correct or not. So likewise, we are identifying and we are examining their performance. So for the evaluating purpose, we are having a set of criteria. So each and every members. So one example of one medical audit is like if the internal officers, like the new junior staffs, the consultants, they may have some set of questions, and they can ask or they can review how the new junior staffs are working, how they are communicating, whether they are identifying the diagnosis properly. So and sometimes during the ward round, so when we are talking about the ward rounds also, they are talking with the patient, and whether the if sometimes whether the particular junior staff or the junior physicians, whether they receive all the necessary informations, and after that they did he or she comes to the conclusion or not. Likewise, they are having a simple evaluation. That is a kind of medical audit. A clinical audit is a quality process that seeks to improve the patient care and outcomes through the systematic review of care of healthcare team against explicit criteria and implementation of changes. So normally when we are talking about the medical audit, there we are reviewing how the physicians are working, how how they are having a records. But when we are talking about the clinical audit, it is mainly focusing on the quality of the patient care. How the nurses or the other paramedical practitioners, how they are providing the care for the patients, whether how the quality of care or whether there is any needs to improve the particular care services. So those things they are having a systematic evaluation. And they are implementing. If there is any changes needs to make, they are implementing through the clinical audit. So this is we are telling it as a medical and the clinical audit. The systematic critical analysis of the quality of medical care, including the procedures used for diagnosis and treatment, the use of resources and the resulting outcome and the quality of life for the patient. So yes, so here it is normally audit means it is a critical analysis or the assessment. So mainly here they are for the medical audit, we are focusing on how quality of medical care is giving to the patient, like about how they are identifying the diagnosis, whether they are mentioning proper treatment for that diagnosis, whether they are using the available resources effectively and efficiently, and with the treatment, how the patient life, the quality of life of the patient, how whether it is improving or not. So those comes under the medical audit. Identifies opportunities for improvement and suggests mechanisms through which action is taken to make and sustain those improvements. Yes, so through the medical audit, we can identify whether there is any chances for the improvement. The ongoing medical care or the nursing care is good, or whether there is any changes could happen, or whether there is any changes needs to improve the quality of care. If so, if you are going to suggest the improvements, how we are going to do. So we can't do whenever, especially when we are talking about the treatment options. I already told you for the patient care, we can't exhibit or we can't implement or we can't exhibit a treatment at once or over the patient. It should be going like a step by step. So at the same time, so if you are going to change any treatment options also, you need to do it in a sequential order, step by step. So those things you need to analysis, you need to evaluate. So those evaluatory components are coming under this medical audit. So this is about the medical audit. And we'll move on to the clinical audit. Especially there are two types of clinical audit. Under the clinical audit, so clinical audit also one type. Under the clinical audit, we are again dividing the clinical audit into two parts. They are concurrent audit and the retrospective audit. Concurrent clinical audit and the retrospective audit. So the concurrent clinical audit means, so we are evaluating the care at the time when the care is going on. Like if a nursing officer is providing a treatment or providing a care to the patient, at the time through the direct observations, we are observing. So we are observing how she is doing a care. Whether she is, if we talk about the administration of intravenous medication, whether she is cleaning the site area, if there is any blood stains over the cannula, whether she is changing the dressing of the cannula, how she is positioning the hand, whether she is communicating with the patient. So those things. So when the care is providing at the time with the direct observation, we are observing. And it is a kind of clinical evaluation, clinical audit. But the retrospective audit means care is evaluated after it has been completed. So soon after, now when we are talking about the nursing care, I'm talking nursing care in the normally nurses, they are instructed to put one care plan. So in our second module, the assessment process, we will see what is this care plan writing, nurses note, all the things. So each and every care plan means it is there are some criterias are there. So soon after finishing any kind of care to the patient, nurses are instructed to write. So what they did to the patient. So and at the last, we need to mention. So through this care, how the patient is feeling. For example, if the patient is complaining that I am having pain, then the nurse is going to give the medication, pain medication for that. And after some time, again the nursing officer coming and asking how you are feeling, whether your pain reduced or not. So patient may tell, my pain reduced or still I am having pain. So first we are writing, we are recording. So how about the first, how before giving the medication, how the patient complained. So what she did for that complaint. And after the medication given, how the patient is now. We are evaluating. So that point we are calling evaluate. So we are having a written document. So after finishing the care, another nursing officer or any other people who are coming for the evaluation, they are go through it. How the particular nursing officer did the procedure, what the patient complained, what she did, and after the particular care, how the patient is again what is the response of the patient. So that is the retrospective. Normally, we can have this retrospective audit in any kind of institution. So it is one example for the health and social care, but the retrospective, the meaning of retrospective means we are gaining the answer. So we are getting some informations or we are getting some evaluatory activities through the documented from the documents. So if you are going to evaluate any record, the evaluations of the recordings or the reports, they are retrospective. So the clinical audits, there are two types. We can have the auditor evaluation at the time of care providing, or we can have after the care providing by go through in an accurate manner with all the records. So there are two types, concurrent audit and the retrospective audit. So are you all clear about the types of clinical audit? Or do you have any doubts?
No doubts.
Okay. Next, we'll move to the need. Why? Why we, who, not why. So, who are the people needed this medical audit, or why we need this medical audit? So, need for the medical audit, first one for the professional, for the healthcare professionals. If we have the periodical medical audits or the clinical audits, then it will be helpful for the healthcare professionals to improve their professionalism, and also it would be helpful for the care proficiency. The each and every healthcare professionals, they will understand how they are providing the care to the patients, and if there is any need for improve the care services, then they can improve the care. So it one is for professionals. Healthcare providers can identify the deficiency and make necessary corrections. Then for the society, to ensure the safety of public and protect them from care that is inappropriate, suboptimal and harmful. Yes, if we have the medical audit, it is not only helpful for the healthcare professionals, not only for the healthcare providers, as well as the care receivers to the public. So with this, we can have whether the public or the patients or the clients, they are receiving the optimal care, or the care is appropriate or inappropriate, or whether the care is going to produce any harm, or whether it's going to improve their health status. So for the society, it's important to have this medical audit. For the health promotion, to reduce the patient sufferings and avoid the possibility the patients of available services or injury. So for health promotion means, so through the health audits, we can, if the patient is having any sufferings, if the patient is suffer from the care, so we can reduce reduce it, or we can avoid the possibility of harassment of the patients, or if the patient is going to have any injury or the available services are not appropriate, so those can be reduced or those could be prevented through this medical evaluation or the auditory evaluation. So these are the three needs. We have this medical audit. One for the healthcare professionals to enhance or to improve their professionalism, and for the care receivers to have a optimal and the proper accurate care, and at the same time for the health promotion of the community or the public who are receiving the care services by the healthcare providers. Then we'll see the purpose of this clinical audit. So we now see the medical audit. Now we'll see what are the purpose, why we need this clinical audit. To plan the future course of action, it is necessary to obtain baseline information through the evaluation of achievements. Yes. So when we are talking about the health and social care, so each and every day new diseases are coming. So when we are talking the current situation also, COVID-19, then there is a monkeypox, like that. New diseases. There are disease outbreaks are there. Okay, so although they are those outbreak, so this monkeypox are not new. Already in 90s, 70s or 80s, in 20s, they occurred. But for our generation, it's new. So we are hearing for the first time. So each and every day, again, those diseases are coming new and new. So not the same care management is appropriate for all kind of diseases. Why? Even the causative organism, they became very resistant to the treatment. So for example, normally we are telling, if we starts to take Panadol, the simple Panadol for any kind of simple stomach ache, simple vomiting, simple fever, the body become resistant to that Panadol. The resistance means although you are having a fever or abdominal pain or whatever, stomach pain, if you get the Panadol, it won't respond. So then you need to get another strong dosage medication. So why it happens, if you continually taking for each and every small things a same medication, then the body or the particular causative organisms, they becomes adaptive to that particular medicine. So that drug or the medicine, it won't kill or it won't cause any damage to the causative organism. So that's why we are telling, no, normally we are not prescribing even the Panadol we are not prescribing. And sometimes we are normally telling that some people, they are having a habit of putting the Vicks to the normal, even a simple headache. Okay. So if the headache is very severe, okay, we can put, but if you start to put for even the mild headache, then the Vicks won't respond if you are having a severe headache. So we need to identify, or we need to have different treatment options for the newly emerging diseases. And also not all the treatment options could be can be held by the all kinds of patients' body. So if I am having, so if I am good to have the surgery, so some other patients, the body is not adaptive, or the body can't hold the particular surgery. So we need to go for any other treatment options. So if we have the clinical auditory or the clinical auditory evaluation, then we can identify. So what are the new management, or what are the new treatment options we need to form, or we need to have in order to protect the patients from a particular disease. So if we have the clinical audit only, we can identify for the future actions through the evaluation of the current current available care activities. For comparison purpose with a view to improve the service. Yes. So it is also similar. We can compare. So before the clinical auditor evaluation, how the care was. After how it was. So we can improve the services, care services to the patient. It is regulatory in nature, ensuring full and effective utilization of staff and facilities available. Yes. So with the clinical auditor evaluation, we can identify whether the resources, the staff, the staff and the equipments are utilizing in well manner, or whether they are wasting, whether the resource management is going in a good manner. So we can identify those things. Assess the effectiveness and efficiency of healthcare programs and services put into practice. Yes. So the healthcare programs that are going on for the outcome, for the good outcome of the patient, whether they are effective or they're efficient. So how they are going, whether they are cost effectiveness or whether they are undertaken a particular period of time, those things. Describe and measure the present performance, how the presenting performance is. So whether the care whether it is in an expected way, or the performance is over performance or underperformance or within the normal limit. So we can describe and measure. Help developing explicit standards or the guidelines. So it will help to develop the guidelines in the future terms. Suggest what are the needs we need to be changed. So whether we need to make any altering treatment options, or this treatment option is good or bad, whether we need to improve, and help to mobilize the resources. So with the clinical audit, we can encourage the healthcare providers to utilize and to use the available resources more and more. So at that we can help to change the resource management as well. And also it can help to evaluate the past and modify the present process. Yes, if you are having any present care, then you can compare with the past, how the past care was, and if the past and the present care is same, then you need to instruct the particular healthcare providers to change the care proficiency. Why? If the past and present care services are similar, then it won't help any. So it is not producing any good outcome to the patient. Then through the clinical audit evaluations, you need to instruct to change the care services. So for the good outcome in the patient and to improve the quality of people or the community, we need to have this clinical audit. Then we have the prerequisite for the clinical audit. Prerequisite means what are the essential components. Prerequisites, normally we are telling the components. What could be present when we are talking about the clinical audit. So in the clinical audit, we are having three major main parts. One is medical audit committee. Yes, each and every hospitals, they are having a separate committee called medical audit committee, who are responsible for this auditory evaluation, both for the clinical audit as well as the medical audit. So this medical audit committee definitely contains both the healthcare physicians, nursing officers, the higher nursing officers, other paramedical higher people, and the hospital statistics. So we are having separate departments. So we need to have some statistics. So in the statistics we are having, so the total each and total number of beds, total number of doctors, total number of nurses, whether the beds, the total number of bed means the patients we are, and how many patients are admitting to each and every ward per day, how many discharge, what about the death rate, what about the maternal death rate. Maternal death rate means pregnancy, the pregnant women who are dying. What about the childbirth, all those things, they are having a separate statistics. So the hospital statistics. Well organized medical record. Yes, so each and every part we should have a medical record. All the medical record will have all the death rate, birth rate, admission, discharge, disease outbreak, and medications. All the records will be there. So these are the major three essential components when we are talking about the clinical audit. So medical audit committee, hospital statistics, and a well organized medical record. Now we'll just brief out regarding the nursing audit. So the nursing audit also will comes under the clinical audit. So nursing audit is one of the subtype or the small component of the clinical audit as well. So nursing audit. So why I'm mainly focusing the nursing audit, because most of the time when we are talking about the care proficiency, the nurses are mainly involving. Doctors, other healthcare professionals also involving, but most of the time nurses are spending more times with the patient, and most of the care proficiency, the mainly the doctor's treatment. The doctor's job is they are diagnosing the disease condition, and they are providing the treatment options, what we can do. But other management, even giving the medication or giving any basic hygienic care or giving the pain, whatever the care, they are not done by the doctors. All are done by the nursing officers. So the nursing audit also important. So nursing audit means we are reviewing the patient record design to identify, examine, or verify the performance of certain specific aspects of the nursing care by using the established criteria. Yes. So here we are reviewing how a particular nursing care is going on. So for that, we can review the patient care, the records of the patient. That's why I told you that each and every care, after the care, the nurses are requested to put, it is mandatory to put the care plan and the nurses note. So those are the kind of the legal document, a reviewed document, the records. So we need to check. So for the nursing audit, they are going to check those care plans and the nurses note to check whether the care is very well, very designed, going on or not. In this case, the medical records are examined with respect to types of nursing care given. The clinical audit process seeks to identify areas for service improvement, develop and carry out action plans to rectify or improve service provision, and then to re-audit to ensure that these changes have an effect. Yes, so we are both the medical audit, nursing audit, or whatever the clinical audit. So first we are evaluating and we are identifying whether there is any alteration could be made. If yes, so again, those alteration could be comes to the implementation. So once they starts to practice, then again they are having a re-audit how after the implementation of the new changes, policies and the care. The audit may be retrospective or the introspective. Introspective means that I already told you the concurrent clinical audit. The audits that we are doing by observing at the time of the care. Retrospective, it is especially we are go through all the records like care plan and the nurse's note or other records of the healthcare professionals. So from the recording, from the records or the particular reports, we are getting the information through a accurate evaluation. So that is, we are calling it as a retrospective audit. Then we'll move to the evaluation of quality of care. How we are going to evaluate the quality of care. So mainly quality of care evaluation for goes to the patients. How we are going to evaluate the patient's quality, the care that we are giving to the patient. So there are three parts: quality of technical care, quality of art care, administrative support. So here, so the quality of technical care means, so we can assess by adequacy of diagnostic and the therapeutic process. Yes, technical care, the availability of technical equipments, diagnostic equipments like CT scan, X-ray machine, or when we are talking about for the treadmills normally in the hospital setup we are having, or other any other car and that ECG machine and the CTG machine. So all the machines, the technically we can handle the machines that we are using for the diagnostic purpose. Diagnostic purpose means for the diagnosis, for the observation. So through the visualization or the observation, we are identifying, so this patient is having something abnormal. That is diagnostic. Therapeutic purpose means management, treatment. For the surgery, there are lot of equipments are using. Or for if the patient is having breathing difficulties, the patient is difficult to have breathing, then we need oxygen cylinders. So it is common. So the word oxygen cylinders, there are unavailability of oxygen cylinders, the oxygen are running out. So those terms we have heard we are familiar after the COVID-19 pandemic. So those we are calling it as a therapeutic process. So technical care means the availability and the utilization of the technical instruments which will helpful for the diagnosis of the disease as well as the treatment option. Art of care means the way, the behavior of the healthcare provider when they are delivering the care and communicate with the patient. Yes. So how they are behaving, how they are communicating, the words that they are using, the phrases that they are using, their body language, how they are standing, whether they are smiling or not, the tone of their voice, the pitch of their voice, and the facial expressions, the gestures. So this is we are calling it as an art of care. A doctor is expected to know not only how to treat a patient, but also treat the dying patient. Yes. So this is important. Normally, the treating the patient is the important one. But when we are talking about the dying patient means the patient, they are having very, very short a period of life. Soon they are going to die, like a cancer patients. So the patients after nowadays the several cancer treatment options are available, but those cancer treatment options could be helpful once they are identified at the beginning. But when we are talking about the brain tumor, leukemia is a blood cancer, there is a very, very low chances or low probability of saving the life of the patient. But other cancers we can help, we can stop the cancer, we can treat once before the metastasis. Before the metastasis means before the spreading of the tumor or the cancer cells to all over the body. So once we identify the cancer at the very first stage, there is a high probability of saving the people. Or if it fails, or if the patient is at the end of the life, so we need to have more prominence for the dying, that kind of patients. So those we are referring to the dying patient, not only for the cancer, any disease condition. There people are having very, very low survival rate, low days, or the very short days for their living. And within that short days, they will suffer lot and lot. The pain. So for example, when we talk about the cancer patients, at the end of their life, they are having more and more pain. So they can't express that. So they will suffer lot and lot. So as a not only a doctor, even the nursing officer, whatever the healthcare professionals, when you are going to provide a care, you need to be very, very cautious when providing those people. So it is common to provide, it is common to have a good behavior, good attitude, good communication pattern. When we are going to provide any care to the patient, but mainly you need to emphasize this patient. Okay. So that is we are telling a art of care. It is one of the quality of care we are going to give. Administrative support means planning, organizing and directing all resources of patient's care. All resources of all resources for the patient care to maximize the productivity towards better patient care based on the evaluation report. So administrative support means yes. So to have or to maximize the patient care, we are evaluating the reports that are proposed by each and every healthcare professionals. And we are planning what are the care managements are there and how we are going to implement those things, how we are going to organize all those things, and we are governing. So we are having an administrative purpose in order to have a good outcome in a patient care. So those are the major three elements or the components of the quality of care. Technical care mainly focusing on the instruments that we are using for the diagnostic and the therapeutic purpose. Art of care means the way of the behavior, attitude, communicative patterns of the healthcare professionals and the administrative support, the activities, the action plans that are going to undertaken by any of the healthcare professionals in order to enhance the productivity or the care of the patient. Okay. Okay. Now we move on to the roles of hospital administration. So how the hospital administration works or helps, or what are the roles or what are the impact of this hospital administration having in this clinical or the medical audit. So first, it is helps to provide a good working environment. Yes. So if the auditory medical or the clinical audit, if it needs to be good outcome, then the working environment of the healthcare professionals should be in a facilitated manner. It should be a very good working environment. So those needs to be provided by the hospital administration. It should provide the physical facilities, resources, and the smooth supply. Yes, it should have some kind of physical facilities. Physical facilities means so having a day off, providing a day off, or having not constricting the employees to work so they can have some kind of fun and all those things. So they are providing some physical facilities, relaxation to the particular healthcare professionals, and they need to provide the adequate resources without any conflict, and those resources needs to be provided without any invalid inquiries. So the smooth supplies will it will be important for having a good medical and the clinical auditory outcome. To motivate to enable the medical care providers to work enthusiastically. Yes. So the administration should have some kind of motivation. They can appreciate, or they can, they can appreciate, or they can award them. So, or they can provide promotions in order to then only the medical care providers they can work. So what, not only the medical care providers, even when we talk about any workplace, if we have an appreciation, awarding, promotion only, we will motivate ourselves. We will have some kind of motivation. So those kind of motivation should be given especially for these medical care professionals as well. To attend another patient's complaint grievance. Yes, to attend another patient's complaint and grievance means sometimes so the patients may complain. The thing is the complaints or the complaints that are provided by the patients, sometimes it could be true, but sometimes it could be false. If the patient is having any conflict with the healthcare providers, if the patient is not satisfying with the care, that means the care provider is good and they are providing the good care, but sometimes the patient may having any personal grievance, personal vengeance. In that manner, there could be a chances of providing a fake complaint about the healthcare provider to the higher authority. In that manner, so the hospital administration, they can't take the activities directly to the healthcare provider. So they need to have some kind of evaluation, a complete evaluation, and they need to find whether the complaint provided by the patient is actual or not. Then they have can take a further management. So why I'm telling like this? Because the particular healthcare provider, the care provided by the particular healthcare provider could be very, very good. So if we take an inappropriate action among over the particular healthcare provider, then there is a higher chances of losing a good care provider. So for that, we need to attend the so it is okay to ask, or it is okay to listen all the complaints and all the grievance provided by the patient. But when you are going to take any action as a management, when you are in a management part and when you are going to take any actions, you need to have some detailed clarification. So detailed authority. Sometimes the patient's complaint could be true. So after the full detail clarification only, we need to have the action. Okay, so to, and at the same time, on the other hand, so sometimes the hospital management may think that patients are telling, because they won't that means sometimes the hospital administration, they won't accept the complaint. Sometimes the complaint may be true, but they won't accept the complaint. Why? They may think their reputation of the hospital may goes off. In that manner, they won't consider about the activities undertaken by the healthcare provider. So if they leave the healthcare provider like that without considering the complaint about the patient, he or she is going to do the same thing for other patients as well. So then the quality of care provided to the patient become reduced. It is not in an appropriate manner. So in an auditory evaluation, it could be happen. So we can identify that. So if in the auditory evaluation we identify those things, then the hospital administration should be take the uh, immediate action. So this means if they listen to the patient complaint, then the chances of reducing the risk is increased. So for that, they need to attend another patient's complaint or the grievance as well. To edit and monitor the media coverage notes and the patient satisfaction surveys to reveal the gray area. Yes. So they need to have the patient satisfaction surveys. They need to have some kind of surveys from the patients. Then only they can identify whether there is any hidden areas. So whether the patients, because the healthcare providers, they may tell that we are providing a good care, but the people who are receiving the care only can tell whether it is a good care or the bad care. So the hospital administration should have some kind of patient satisfaction survey as well, to conduct exit interview and make changes as suggested. So yes, so if there is any suggestions are provided after this audit, the administration should take those into consideration, and if they think they are good, and they need to uh, focus them, and they need to use them as a practice to frame the clear-cut objectives and policies. Yes, with the auditory the evaluation, the results of the evaluation, they can have some clear understanding about the objectives and policies, which could be helpful for formulating the new policies and procedures or the laws in order to improve the patient care services. So these are the major roles that the hospital administration should take when we are talking about the auditory evaluation. Then these are the advantages of clinical audit. So what are the advantages that we can have when we are having the clinical audit or the medical audit? And educational activity, yes. So through the clinical audit, the healthcare providers, they are starts to learn more and more. Through the auditory evaluation, they will start to learn more and more regarding their professionalism. So with that educational activity, they can enhance their practice as well. So they are promoting the understanding. What are their roles and responsibilities? How they are going to deliver the care. So they can have some understanding through the educational activity. So they can use the resources effectively, and they can raise the standard. Standard means once they know the through the education activity, they can identify what are the guidelines and what are the principles, and also they can raise or they can put forward regarding the principles and the guidelines, and they can promote the changes within themselves. So if they promote the changes within themselves only, it could be the changes could be happen to the patient care. So promote the changes, and they can identify different informative sources. So the updated versions, how the world is going on when we are talking about the medical and healthcare. What are the equipments they are using? What are the medications that's coming newly? And what are the practices they are using newly? So source of information. Peer-led and peer understanding. Peer-led and peer understanding means the understanding between the co-workers, the other healthcare. So how the other nursing officer is working, the colleagues, so how they are working. So they can understand why they are doing these things, and involves the patient. Yes, if they have the clinical audit only, they can involve the patient. So when we are having a periodical or the continuous clinically auditor evaluation, then they will know, okay, so we need to improve ourselves and we need to give a proper care to the patient. Then only we will have a good reputation. So they start to involve the patient more and more. They will consider patients more and more when they are providing the care. So these are the basic or the most important advantages that the patient as well as the healthcare providers can gain from the clinical audit. So although we are having advantages in the clinical or the medical audit, so when we are going to implement or when we are going to apply these medical and the clinical audit, the problems or the issues could be occurred. So the major issues are the medical record department. So the medical, I already told you, we are having a separate committee, medical record committee or the medical committee. So the members of the particular committee they are not well organized, or whether they are not well expertised. If it is not well organized or not well expertised, or the available records are not in a proper manner, then it could be an issue to have a accurate medical auditor evaluation. Or then the other part, the incomplete record or the poor record maintenance, fear of action and lack of motivation of medical staff. So sometimes the medical staff or the healthcare providers, they may have not, they are not having a motivation. There is no any motivation. They are doing the same thing. Or otherwise there are no any fear. So if they have any counter action only, they may have some fear and they will do. Or if there is no any fear of action. Ignorance of value of medical audit by hospital staff. Yes. So if the medical auditor evaluation is not going in a proper manner, if it is not performing, or if it is not having any proper evaluatory outcomes, then the healthcare providers, they are not considering the medical audit in a serious manner. They start to ignore or they start to neglect. So if they start to ignore or neglect, then there is no any use of having the accurate medical auditory evaluation. Suppression of facts. Oh, yes. So they are not providing the accurate facts. They are suppressing. They are hiding the facts and they are reporting wrongly. So these are the common issues that it could be arise when we are going to have a medical audit or the clinical audit. So these are the contents. So I already told you we are having an auditory report. So that auditory report contains some contents or some the parts, that the components that they are included in the auditory report. First one is background. Then literature review. Literature review means they are comparing. So if how about the previous auditory, if there is any previous auditory report, and how about the current auditory report, whether there is any changes. The comparing, we are calling it as a literature review. The previous one, under the literature review, we are writing the previous records and the previous reports. Criteria and standards. What are the criteria? What are the principles or what are the guidelines that you are using for the auditory evaluations? And what are the methods or what are the protocols? What are the instruments that you have used for the auditory evaluation? And what are the results of your auditory evaluations? So are you going to recommend for the further change? So if the auditory evaluation, so if the particular action is not good, so what are the suggestions? So what are the recommendations that you are giving for the upcoming, for the enhancement of, for the future enhancement? Okay, and recommendations for the further audit. So are you going to recommend for further audit? Further audit means re-audit. So if you are going to make any changes, are you going to re-audit that? Or you are going to have any further audit as well? So these are the contents that we are including in a auditory report. Once soon after we finish the auditory evaluation, it should be very detailed. Okay, are you all clear up to now? Or do we have any questions?
No, ma'am. Go ahead.
Okay, thank you. So this is a audit cycle. So this audit cycle is similar to the policy cycle. We yesterday we studied how we are doing it, because audit is also a kind of evaluation, a policy evaluation. The policy, not policy cycle, policy evaluation cycle. It is also audit, also a kind of evaluatory method. Okay, so these are the components of the audit cycle. So first you need to identify the topic. So why the problem? So you first identify why you are going to do a audit. What is the need? What is the purpose? So you need to choose a topic. So then you need to have an objective or the guidelines or the principles. So through this audit, what you are going to achieve? What is your expected outcome? So normally, if if the care provided by the patient is not good, so through the observation you are identifying that the particular staff is not providing a good care, then you need to have some objectives how you are going to achieve or what we are going to achieve. So our ultimate goal is we need to improve the care provided by the particular staff. So that is the objective that we need to state. So if we set the objective, then we need to collect the data. So how we are going to collect the data? So we can use any method, data collection method. And so with that data collecting, we are going to check whether we are going to achieve it. Are we achieving it or not? So are we going to change that particular staff professional activities or not? Then we are analyzing. If not, so if the achieving is data analysis, if not, why are we not achieving it? So that is the analysis. So we are collecting the data. Under the data, we are checking whether we are achieving it or not. So if we are not achieving a particular objective or the principle, then we are analyzing why we didn't get. So what are the drawbacks are present? Which actions preventing us to get from or preventing us to achieve that particular objective? Then after analysis, we can come to some, we are identifying these are the problems or these are the things that are interfering or interrupting to get that objective. Then we are implementing, we are changing. So we are doing something or we are having a solution, a kind of solutions or suggestions we are making in order to make the things better. The things better means the interruptive factors. So we are having some solutions and ideas how we can enhance or how we can change the interruptive factors in a better manner. Then we are going for the re-evaluation. We are going for the re-audit and we are checking whether the now or the new solutions are good or bad, whether they are providing the expected outcome or not. So this is we are calling it as an audit cycle. It is similar to the policy evaluation. Here I have marked some tips. So how you can improve or what you can do in order to have a successful auditor evaluation. It is not only for the health and social care, in any kind of organization or any kind of workplace. So first you should have a adequate staff. That staff should be well trained, well expertised, well-trained and well-expertised staff should be involved. Okay, the next one is enlist the support from the organization. Yes, so you need to have a support from the higher authority, from the organization. Then only the audit could be very, very good manner. A team approach. The members of the audit committee members, they should be involved all the relevant staff. So if you are taking one company, so the people who are involved in the audit team, they should be relevant to the particular field and they should be expertised, and each and every members have the ability to work in a collaborative manner, cooperative manner. So there could be a team approach should be there. Agree confidentially of findings. Yes, they should agree to keep up the things that they are the confidentiality. They should agree to keep up the in a secret manner. Confidentially, they need to keep up the results or the findings in each and every member of a particular committee. Allow sufficient time. Protected time is helpful. Yes, you need to you need to give a particular time. You can't rush. You can't rush to take part the audit. You need to have you need to give enough or the plenty of time to take this auditor evaluation. The data collection. So the data that you are going to gather with the help of various methods, it should be very, very accurate and it should be good enough for the analysis. And deliver the intensive feedback. So the feedbacks that you are getting, it should be very intensive manner, very good manner. So these are some of the tips that you can incorporate to have a successful audit. So here you can use this PDF. So it is a clinical audit policy. This PDF containing the clinical audit policy, which was proposed by the National Health Services by the United Kingdom. So normally this clinical audit policy used by the health for the hospitals or any private sectors or for the healthcare professionals, employees, employers who are registered and who are working under the National Health Services. So you can go through for your extra reference. So I have put this PDF, you can click it and you can go through it. So that's all about today's sessions regarding the audit. You can ask your questions or you can tell your opinions or suggestions regarding the today's session. Are you clear or do you need more any clarifications? You can ask.
Hi, ma'am.
Yes?
I understand, and I think the audit is very important for conducting or holding any other organization or any other uh, uh, firm.
Yes.
So audit can resolve any conflicts and can make future forecast decisions and clearly identify what are the mistakes, what are the developments, what are the what we should do or know. So audit is, I think, most important for uh, social sector, private sector, government sector, any other organization, and I think it will be apply for already we mentioned um, uh, doing quarterly, yearly, or annual, any otherwise. So monthly or, and it is very important. Thank you,
Yes.
ma'am.
Thank you for your explanation. So so I know that you have understand, you got some idea regarding what is this audit and why this audit is important regarding the policy evaluation, those things. This audit is very, very important on the same hand. So
Okay,
now
ma'am.
I
Thank you.
wish to brief out regarding your assignment. So So I will upload both the Word and the PDF the documents both in the MS Team as well as I will share in the WhatsApp group. So I think you already got some idea in the previous lectures. I think Miss Ganguly, she told how you are going to uh, write the assignment. So the guidelines for all the assignments. So for each and every module, so you are having to finish 6 modules. So when I'm talking about my module, so I'm having 2 modules. So for each and every module for the 2 modules, you need to complete altogether 4 assignments. So one module, you need to submit 2 assignments. So those 2 assignments will cover all the 4 learning outcomes. So today I'm going to issue the first assignment only, as we didn't finish our the content or the contents of the second assignments. There are some more contents I need to finish. So once I finish those contents, I will issue the second assignment as well. So I know you have some idea related to the assignment submission. So here, this is your cover page. So in this cover page, so as it is a PDF document, you can't edit the PDF document directly. So for that, I'm going to give the Word document as well. So here you can write your name, your registration number, for the autumn registration number, and your Somerset admission number, your contact number, and the email. So we are planning to provide a common email to you all for each and every module. Once you finish your assignment, you can directly upload it to that particular email. So it will be easy for you all, because most of you are having familiar for the email handling. So for that feasible, we have decided this. So soon we will provide the common email to you, or if there is any changes, we will inform in future as well. So here so the date of delivery of the assignment is today. So we will provide 30 days, nearly 1 month of period for your submission. So you can submit it on or before 7th of September 2022. So only this part you are going to fill. So this is for the accesses for the people who are going to mark examiners. So here I have put up the module, regarding the module, uh, the promoting equality, diversity and inclusion and health social care. So here you can identify the aim of the unit as well as the learning criteria. So what are the major learning outcomes and what are the criteria that we are including in our session. So in each and every presentation, I am putting the learning outcomes. So those learning outcomes will cover this each and every criteria. So so this is the rough idea about the module. So here your assignment brief. So the task is 1 of 2. So I already told you, each and every module you need to submit 2 assignments. So this is the first assignment for this particular module. So this assignment will cover the learning objective 1 and 2. Under that, we are having 6 criteria: 1.1, 2, 3, 4, and 2.1 and 2.2. So you need to submit a report. So like you know what is report means. So in that report, you need to include all these points. So first you need to define the terms like diversity, equality, inclusion, unconscious bias, what are the protected characteristics regarding the human rights and discrimination, and you need to explain what are the legislative acts are there which are helped in the promotion of the equality, diversity, and what are the models that are explaining, and what are the barriers and how the barriers are affecting the promoting equality and diversity, and regarding the effectiveness. So regarding the policy monitoring and how you are going to examine the effectiveness of the policy, and how you are going to evaluate the efficiency of the procedure policy. So all those things you need to have a detailed report. So your report should contains all this information, and the word limit should be 1500 words. So those were the 1500 word, excluding the diagrams, references and appendices. So if you need to provide the references. So for the references and in the diagram, if you are going to write anything, so those word count won't included in the major report content. So except those, the major report content should have the 1500 words, and you are requested to submit your report in a Word format, not in the PDF format. It should be in a Word format. So you need to be very careful regarding the word limit. The word limit should be 1500. It shouldn't exceed the 1500, and you need to include maximum, you need to include all these things in your report. And referencing type, I hope that you all have idea how you are going to put the references, especially in the Harvard referencing style. As I think Miss Ganguly, she explained in detail. And if you are having any doubts, still if you are having any doubts regarding the references, how to put the reference and how to add the citation and all those things, you can ask me, I can explain you. So because I didn't prepare anything regarding the reference type, because I hope that she did already. But if you're having if you're having any doubts how to put the reference and how to download the PDF and all those things, you can request me. And if you request, I will explain it in our coming next class. Okay. So this is the assignment, first assignment, and the assignment guidance. So there are some set of criteria you need to follow when you are preparing your assignment. Yes, it should be an individual assessment. It is not a group. We are allocating only for the 30 days. We are not accepting the late submission unless if you are providing a valid reason. So if you are going to provide any valid reason, and if we are going to think that the reason is valid for the late submission only, we will accept. But most probably we are not accepting the late submission. So stick on that. You must need to submit on the time or no before 7th of September 2022, and you should needs to submit as a Word document. Any other format is not acceptable. And the word count, you should need to adhere to the word count as well. And the citation and the reference should be followed in a Harvard style, no any other citation style. And here you need to follow these as well. The assignment, the space between the lines, it should be 1.5. No, so you need to be careful whether the lines between each and every, the line space between each and every phrase should be 1.5. And the font is Times New Roman, and the font size should be 12. So the margins, you need to customize the margin, and the alignment, it should be justified. And regarding, so you need to put the page numbers in the footer, and the header, it should contain your OTHM registration number in every page. So the following format should be followed when you are submitting the assessment: modules and standard. That means the assignment brief and plagiarism declaration page and the assignment. So you know what is plagiarism means. So plagiarism, so you are you are allowed to get any PDF for your reference, but when you are using one PDF, so you can't use the same phrase, words, or the sentences as it is in the particular PDF. So plagiarism means it is a kind of illegal activity. So make sure you are not allowed to use the plagiarism. You can't, your document or your assignment shouldn't be a plagiarism. And we will check whether it is plagiarism or not, whether it is unique or not. And the assignment will be evaluated. The first and foremost, it should be a plagiarism. Okay. And how you are writing, so how you are providing your suggestions, and the way that you are writing, so the style you are using, so all those things we will check. And the sentence structure, how you are using your grammar and the vocabulary, whether you are using the punctuation marks in appropriate places. And argument means how you are, so you can argue, like how you are justifying with the problem. So you can have a current problem and how you are going to justify your answer, your suggestion. So a kind of argument setting, and presentation of findings, and what are the conclusions. For if you find any problem, so how you are going to conclude, what are the conclusions you are going to make, and you need to mention the conclusion in the report as well, and the reference and the citation. So citations, so whatever the documents that you are using, you need to cite at the end of the sentence. So you can reference at the end, you can attach the reference error. So under these are the criteria that we will be used for evaluating your assignment. And here, so the student assessment, submission and declaration. So here also you need to put the date, and you need to put your signature and the date that you are telling that you are not using any plagiarism, and you are declaring your fully, you are accepting and you are taking the autonomy for all the assignment that you are made. So this is regarding my module for the promoting, and you can, if you are having any doubts, if I need to explain in Tamil or Sinhala in further, you can ask me in person, or if you request, I can explain further in our coming lectures. Okay. So if you are not having any doubts regarding today's session, we can wind up the session. So shall we wind up, or do you need to tell anything or any other doubts?
We have to use same rules as Miss Ganguly said, na?
Yes, yes. For all the assignments, we are having one guideline. So because if we have separate guidelines, then it will be difficult for you and you will be get confused. So that's why we have talked and we have formulated a one common guideline. Only the module name and the content of the report could be changed. All the other things are same. You need to follow the same thing.
Okay.
Okay.
In here, in this assignment, that word counting. What is the word counting?
1500.
1,500.
Yeah, except the reference and the, if sometimes in the diagrams there may be some word counts. So we are not going to count that word counts. So except the reference and diagrams that you are using, other major content of the word count should be 1500.
Miss Kangri said, Miss, task 1 and task 2, and
Yeah.
task 1 is a report and task 2 is the essay. Can you tell the what are the differences between those things?
So essay means we are normally writing, we are not having the normally report. In the report, you can provide suggestions, or you can argue the current settings, so you can take one problem and you can put your suggestions, and you can have some critical argument like that, why this problem is happening, what are the problems, you can, why this problem now, why it is happening, and what are the solutions you can do. It is a kind of argument writing. So in the report, you are having a full content. You need to, whatever you are telling, you need to provide the evidence. In the report means like, you need to justify each and everything that you are going to say. You need to justify it. You need to provide a evidence for that. But essay means there is, so if you want, you can justify it, you can write that. But normally essay, we are not focusing on the justification or all those things. We are just writing why it is happening like that. Normally in the school times also, we are writing an essay. In our university life, we are writing an essay. So that is essay. Report means you need to justify whatever the points you are telling, you need to justify it. You need to provide evidence. At the same time, what are your conclusions? So what are the suggestions you are going to give? So all those things, it should be a argument way. You can write. There are both components like that. It is a report.
Okay, that means in a report we should mention the example.
Yeah, it's important. You should mention the examples.
Okay. Okay, thank you, Miss.
And also, Miss Essay also we can add the example, no? But we are not adding the diagram and other things. We
Yeah, in
don't
the
want.
essay, yes. Yeah, we are not normally in the essay, we are not adding the diagram. And yeah, you can add the example. The thing is just we are telling. For an example, likewise we are telling. But we are not going to deeply clarifying that example. Why we are going to give that example and all those things, we are not going to deeply clarify. In the essay also, we are not using the statistics. We are not using any other statistics. But in the report, if any statistical evidence available, you can use those statistics as well as a diagram or as a table, whatever.
Thank you, Miss. Got it.
Hello. Yes, Miss. Now to structure the facts of the assignment, can we use the headings and subheadings as well?
Oh, yes.
Yes, to structure
Yes.
the facts for the assignment, can we use headings and subheadings as well?
Hello.
Hello. Hello.
Yes. Yes.
Yes, ma'am. I just want to know now when we are structuring the facts of the assignment, can we use headings,
Yes.
subheadings, and structure our assignment?
No. Can you tell it again?
Hello.
When you are right. Yes.
Now, when we are doing the assignment, ma'am, can we use
Yes.
topics and subtopics and structure
Yeah.
our assignment?
Yes. It's very good. If you use the topics or subtopics, it's very well. For the mainly for the reports, you need to use the topics and subtopics, because for the essay we are not dividing any topics or subtopics, but you need to divide it as a paragraph method needs to be followed during the essays, and we are writing in a at once throughout. We are not using any subtopics, but for the reports it is better if you use topics and subtopics. That means so you can use as a definitions, and under the definitions you can use what is diversity, and if you identify there are possible definitions, then you can give one example under that. Then another, if you are going to give inclusion, then you can define that. So it will be easy for the examiners to go through as well. So report is like that. You can have a subtopics.
Thank you, ma'am.
And also in the report, we have to add the content also. Report
At the
content.
sentence or the
No,
contents.
content.
Yes, you need to add the contents as well. What are the contents you need to using? So and I just confirm it and tell to you whether you need to add the contents or not. But I'm not sure whether how they are telling. But for the report, you need to add the contents. It's important. What are the contents you are, because you are going to write. Yeah. For the report, you need to add the contents. Why? We are having an appendices now. So we have told you that except diagrams and appendices. Appendices means in the appendices only you are going to mark what are the diagrams you have used. Diagram 1 which page, diagram 2 which page. Likewise we are marking. So for the report you need to mention the contents as well. So introduction or whatever, background, which page, and then these terms, which page. So what are the things that you are. So for that, you need to have a topics and subtopics. If you have major topics, you are going to put the major topics, and under the major topics, you are going to put the subtopics in the contents. Then you can have a appendices, another page, and in that appendices, if you attach any diagrams or any charts or any pictures, then you can mention. So diagram 1, which page, like that. So, but these things you are not mainly doing for the essays. For the report only we are focusing.
Essay is like just we are writing normal essay, no?
Yeah.
Is it necessary?
Yes. Hello.
Is it necessary?
Sorry, I can't hear you. So, any other doubts?
No, miss.
Yes.
No doubt, miss.
Okay. So, shall we wind up the session then?
Yes.
Okay, so thank you all for joining. As I already told you that if you have any doubts regarding the assignment, you can ask me. I will explain in the next class in detail, especially regarding the citation and the reference type. So until meet you in next class, bye and have a good day.
Thank you, miss.
Thank you.
very much.
Thank you.
Thank you.
Thank you, Vinaya.